Welcome again to the Platinum Men's Health channel. My name is Dr. Ademola Adewale. And before we get started, let's do some quick housekeeping. If you're new to this channel, please subscribe to the channel, like the channel. And when you finish listening to the conversation today, please send some commentary. Once again, thanks for watching. For today's conversation, we'll be talking about what I refer to as a silent killer. What is this silent killer? It is hypertension, otherwise known as high blood pressure. High blood pressure happens to be one of the most important modifiable risk factor for heart attack, stroke, heart failure, or chronic kidney disease. As a matter of fact, 1 in 2 adults in the United States will develop high blood pressure at some point in their lifetime. And majority of patient population diagnosed with high blood pressure tend to be over the age of 40. As this relates to men, majority of men, if you're destined to develop high blood pressure, will develop high blood pressure between the age of 40 and 55. That means after the age of 40, the chance of you developing high blood pressure increases significantly. As for African American men or Black men in particular, the prevalence of high blood pressure is significantly higher than any other races, period. As a matter of fact, the African American population tend to suffer from the unintended consequences of uncontrolled hypertension. The most common cause of renal failure requiring dialysis in African American population is hypertension. As it relates to men, at some point in our lifetime before the age of 55, we will develop high blood pressure. So, how can you prevent yourself from getting high blood pressure? Well, to talk about this, we have to look at the risk factors for high blood pressure. And when we have a conversation about risk factor, you have to look at it in 2 ways: the modifiable risk factor and the non-modifiable risk factors. Let's start with the non-modifiable risk factors. That means the risk factors you cannot control. These are your family history. If you have a family history of high blood pressure, you're probably going to get blood pressure at some point in your lifetime. And if you're a man, it's probably after the age of 40. Race, if you're African American man, that means your chance of getting high blood pressure is much higher than any other population or races. Your gender, that means if you're a man, by the age of 40, if you're destined to have high blood pressure, you probably get it between the age of 40 and 55, because most women tend to develop high blood pressure after the age of 65. So those are the non-modifiable risk factors. Now let's look at the modifiable risk factors for high blood pressure. Those are the risk factors that you as a person can control, which are diet. Are you overweight? What kind of food do you consume? Do you have a lot of salt in your diet? Do you exercise? How often do you exercise? Do you do a lot more cardiovascular exercise to boost your endurance and to enhance your cardiovascular health? Do you smoke? Do you smoke excessively? Do you drink alcoholic product excessively? Do you do drugs? How much stress are you under? Do you have a lot of stress in your life? Or how much sleep do you have at night? Those are the list of the modifiable risk factors for high blood pressure. That means the risk factor that you can control. That means that if you're destined to have high blood pressure, if you modify this modifiable risk factor, you might decrease your chance of developing high blood pressure. So now, how do we screen for high blood pressure? We call it a silent killer for a reason, because you rarely have any symptoms until something bad happens. Majority of the patients I see in my line of work show up for something unrelated. And we found out they have high blood pressure, and they probably had high blood pressure for a long time, and they're already suffering from the unintended consequences. So let me tell you my story. Since I have a family history of high blood pressure, I'm a man over the age of 40, and of course, my race. I started checking my own blood pressure after I turned 40, and I checked it twice a week, and I've been doing this for a couple of years now. Until this past Thanksgiving, on one of my routine checking of my pressure was higher than normal, and I was having some slight headaches, and which is unusual for me. So I checked my pressure several times over 3 days, and it was elevated. So I called my physician, and we decided that I probably consumed too much salt during Thanksgiving. Maybe I should go on some water pills for a couple of days or diuretics. So we did that. After about a week, my blood pressure normalized. However, though, as I continue to trend my blood pressure, as I normally do every week, I realized that it was slowly going back up again. So I sat down with my doctor. We looked at my risk factor profile. I'm not overweight. I eat right. I work out all the time. We narrowed it down to genetic. I have a risk factor, family history for high blood pressure. And of course, I'm a man over the age of 40. So now I have high blood pressure, and I'm now taking medication to keep it controlled. Why is this important? Like I said earlier, uncontrolled high blood pressure is one of the most important modifiable risk factor for heart attack, stroke, heart failure, and kidney failure or chronic kidney disease. So by virtue of me identifying my blood pressure routine screening and having it under control by taking medication, now I reduce my risk of having a heart attack, stroke, heart failure, or kidney failure. So what happened is not everybody will have to be on medication. In my situation, I don't have any weight to lose because I'm not overweight. I don't eat bad food or bad diet. I eat healthy. I exercise. So I do all the things that are modifiable that I can control, but I still have high blood pressure because it's my genetic makeup. So that's why it's important for us as men, once you cross the age of 40, to buy a blood pressure machine, a blood pressure cuff, and check your blood pressure twice a week and pay attention to it. Right now, there are several blood pressure cuffs out there that you can utilize. They've made them so compact. They're synchronized with your phone, with your laptop, with your computer, with your iPad. And you can actually have a chart. And it actually show you trends and tell you if your pressure is high or low. And if you have one of these, you take control of your blood pressure. So when you see a trend that's out of the norm, you bring the attention to your primary care doctor. If you do not have one, then you find one so that we can figure out how to adequately manage your blood pressure so you do not suffer from the unintended consequences. So for today's conversation, the focus was on high blood pressure. What can we do to modify our risk? What can we do to screen our own blood pressure? And what do we need to control it? Because we know now, after this conversation, that high blood pressure is one of the most important modifiable risk factors for heart attack, stroke, heart failure, and chronic kidney disease. So as we talk about men living healthy and living healthy longer, which is the purpose of this channel, to educate men with information to keep you live healthy and longer. Take control of your blood pressure. If you don't have a blood pressure machine right now, try to get one and start screening your blood pressure today. If you have any question, send me an email at platinummenshealth@gmail.com, platinummenshealth@gmail.com. By the way, if you've not subscribed to the channel, please subscribe to the channel, like the channel, and of course, forward the channel to your friends and try to educate them, because collectively as a man, we want to stay healthy and stay healthy longer. Thank you for watching. Until